All right, let's take you to Enugu State. The government of that state is confirming reports of strange deaths in 3 local government areas. The Enugu State Ministry of Health Rapid Response Team, LGA Rapid Response Teams, international and national partners have also visited the local government areas to investigate the reports and take samples for testing. Well, joining us to discuss this outbreak is the Commissioner for Health, Enugu State, and a Professor of Medicine, EMMANUEL Obi. Glad to have you join us, Commissioner. You and your counterpart in Delta made representations to the NCDC, and the symptoms were confirmed to be yellow fever. So what was the next line of action after that?
Okay, so Enugu State government has started taking actions in line with the guidelines provided by the National Nigerian Center for Disease Control. And what we are doing is we're taking all our actions in line with ensuring that we institute case management for the cases of yellow fever that we have determined, in the sense that we are pre-positioning health facilities to take cases of yellow fever and start to treat them. Yellow fever cannot be treated specifically. It's best to give supportive treatment. So we are pre-positioning hospitals for supportive treatment. We are already starting the micro-planning and instituting vaccination, yellow fever mass reactive vaccination in the affected communities. We are also doing active case search in the communities and in the surrounding communities. Then we are also doing risk communication. We are instituting risk communication to ensure that people are aware of what yellow fever is and how it can be prevented. And we have not stopped at this. We have also started to institute aspects of vector control. Since the yellow fever is transmitted by the Aedes mosquito, we have started vector control against the Aedes mosquito. So these are the actions that we are taking.
Okay. And Mr. Commissioner, how would you say your state is coping? Yellow fever is a vaccine-preventable disease. You have said vaccination is underway, if I heard you correctly. But would you say you're coping, or do you need more support from the federal health authorities?
Now, what happens with the health response to yellow fever is this. There is never any point in time when you will have all the yellow fever vaccines that you need for vaccination at any point in time in the world. So whenever there is a report for yellow fever, what happens is that all those stakeholders that are involved start to institute what is called the International Coordination Group for Vaccines, and then providing data that they will use to supply the numbers of vaccines needed to be able to reach the communities affected. What is happening is that as we are detecting the yellow fever in LGAs, the plans to be able to reach that entire LGA or the target population in those LGAs are calculated, and the information is provided to the necessary bodies that will make those numbers of vaccines needed available. We have been doing all this since we diagnosed that it is yellow fever that we are dealing with. And then so far we have started vaccination, first of all, using the routine immunization vaccines that were available. This is because normally you will vaccinate only children 9 months old with yellow fever vaccine. But when you have an epidemic, you now have to target everybody within the ages of 9 months to 44 years. And that is about 85% of any population of any local government. So you have to make a plan, get those numbers, and then you request for the vaccines for the international coordinating group. We have received some vaccines in Enugu State, and we have currently entered one LGA, and we are trying to complete that LGA. And we are entering the second LGA today and actively planning to enter all the LGAs as we continue to confirm the results by laboratory tests. So we are on with the vaccines. We are discussing with all the international organizations and national organizations that will help to make the vaccines available. And then we are getting positive results that we will have enough vaccines to reach to our people.
That's good news on the vaccine front. Let's also speak about the quarantining front and how you're balancing this with COVID-19. What capacity does the Enugu State's government currently have to quarantine people who are exposed to yellow fever, those who have yellow fever? How is the state government managing to balance this with COVID-19 at the moment?
Okay, I want to set the record straight. You don't necessarily need to quarantine yellow fever patients. It's not COVID-19. This is yellow fever. Yellow fever has been endemic in Nigeria, and it just like in other countries, has also been occurring. So we do not need to quarantine patients in the sense of COVID-19. While the COVID-19 activities are ongoing, and we have the capacity, and we are doing what we are supposed to do, what you do with yellow fever is that you pre-position existing health facilities to be able to manage the yellow fever cases. We have a lot of health facilities in Enugu State, public and private. We are pre-positioning public health facilities in Enugu State, mostly the general hospitals, and in some cases, strengthening the primary healthcare centers to be able to cope with this yellow fever issue. We have our health staff there. Pre-positioning simply means that we provide enough commodities to be able to treat the patients that we have there when they come, and they will receive the treatment. The treatment is essentially supportive. It involves antibiotics, it involves rehydrating patients with IV fluids so that they do not suffer from shock, and it involves other supportive aspects of management and some aspects of some barrier nursing, sometimes maybe within insecticide-treated nets, because since it's transmitted with by the mosquito, what you try to do is, if you have an infected person, you try to protect the person from a mosquito bite so that the mosquito will not bite the person and transmit it to somebody else. It's a different disease. It's not like COVID-19. We're not talking quarantine this time. We're talking pre-positioning of hospitals.
All right.
Enugu State has the capacity to handle the yellow fever epidemic as it is evolving.
All right, Commissioner, let me take you back to the question of vaccination. Is there a challenge with vaccination? For example, I am learning that in Delta State, all the cases have no evidence of vaccination, even the one-year-old baby, and that adults refuse vaccination for their children for yellow fever. Do you have the same challenge in Enugu State? And if you do, how are you handling it?
In Enugu State, we do not have that challenge with vaccination. And but what I will say, honestly, is this: access to healthcare services is a choice. And individuals can choose to access healthcare services, or they may choose not to access healthcare services. What the health ministry can do is continue to communicate to our people and give them the advice on the usefulness of accessing health services within the healthcare facilities. So it is not impossible that you may have some pockets of people in Enugu State who may have refused to access vaccination, especially the routine immunizations that should be given to children between the ages of 0 to 1 year old. So let me use this opportunity to encourage our listeners and viewers that it pays to vaccinate your children. And when you don't, such outbreaks can come up, and then those people who are not vaccinated might now be those who might be fairly affected by such conditions. So it is useful to vaccinate. We have not experienced that challenge here, but I can tell you that it is possible that some people may have chosen not to take vaccines, the routine vaccines, and who knows, that might actually be related to what we are seeing right now.
Okay. Mr. Commissioner, can you tell us how many people have been affected by this current outbreak of yellow fever in your state? As some reports have described this as strange deaths, can you also tell us if you have been able to diagnose all the deaths that have occurred as yellow fever related?
Okay, let me say something. When you have your first reports as deaths, what happens is that unless you can carry out a post-mortem examination on all the deaths, sometimes it's difficult to be able to determine exactly the cause of death. But there's a process we call verbal autopsies. And through verbal autopsies, we were able to determine that most of the cases of the strange deaths that were reported had symptoms that were similar to yellow fever. That was why the earliest reports that we made, we said that the deaths may have been caused by symptoms of that resemble diseases of public health importance. What we did was to take samples, and a full gamut of tests were carried out on these samples. We checked for yellow fever, we checked for Lassa fever, we checked for dengue fever, we checked for the full gamut of viral hemorrhagic diseases until we confirmed, through the help of the NCDC and the National Reference Laboratory in Abuja, that it is yellow fever that we are dealing with. Since then, we have been sending samples to the same laboratory. They have carried out the full gamut of tests, and we have repeatedly come out with yellow fever. We have confirmed that the samples we have sent from 3 different LGAs thus far can be confirmed as yellow fever cases.
Well, many thanks to you for joining us today on Newsday, Professor Emmanuel Obi, the Commissioner for Health, Enugu State.